I mean, in Washington, D.C., it's not as severe as in, New Jersey, New York, Michigan. But the place that I went to, it was actually just in a parking lot of a little shopping center, with a 7-Eleven and like just a little pharmacy. And they just told us, all right, we're going to be doing the testing at 6:30 p.m. So I pulled in the car, several other people around there waiting for a while, and it just kind of was, weird, like tension, because it's generally like a fairly empty, unsuccessful shopping center, and then all these
Hmm.
cars started pulling up with nobody getting out. So we're just sitting there waiting, and then finally all these people came out, in
Are
their
there are
protective
there a
outfits and
lot
everything,
are
fully
there a
masked
lot
up.
of patients in those pop-up hospitals?
So I mean, this wasn't really a pop-up hospital, but rather a testing site. So we had about that I saw about 25, 30 cars, and they would just come up to your car. You had to show them your ID, and then they come with the little swab and just all all the way into the back of the head. It's not very
So
comfortable.
so you don't actually see medics when you are doing the testing.
I mean, so there's just one nurse that comes out, and she just checked my ID. She had the swab in one nostril, in the other nostril, and then quickly roll up the window and then tell you to go. So it's just very, very quick. They don't want to spend much time talking to anybody. I actually had my window open a crack in the beginning, and they just said, no, no, let's close
Mm.
it up, close it up.
So
So
they
it's
were
very
also
quick.
afraid of being too close to you.
I guess so, yeah, just because I do know that the hospital that's about 5 minutes away from my house, it's the one that I was born at. They're currently running out of PPE. So, they have to ration all of the supplies that they have, the masks, the protective gear and everything. So they're being very careful. They don't want to have any unnecessary exposure.
And do you worry that you will get enough care if you got infected?
I guess because the system isn't overloaded here yet, I'm not too worried about that. If my systems, God forbid, were to get more severe, I'm more worried about my parents because I've been helping them out. I've been doing all the shopping. My dad's 93, my mom's 71, so for me that's my primary concern. And my wife is now taking over that role. That I'm just, locked up here, feeling kind of helpless. So that's what's frustrating.
And did you pay for the testing?
No. I bought insurance because I live in China full time. So I bought insurance the day that my wife and I landed in Washington, D.C., just assuming that we'd be here for 2 months or so. And then
Oh,
when I found out I needed the test, they said that actually the insurance that I got fully covered it. So the consult with the doctor, the test, that was all free. And if you don't have insurance, the current policy is
mm.
$125.
$2,500 for a test.
No, 125.
$125 for a test.